Hello, Nurse Tim here. I want to introduce you to your thin thinking, which is part of the Nurse Think model. This process of thin thinking is very important because basically what we're doing is we're helping you exercise your clinical judgment muscles every time you do a practice test item, every time you engage a patient in clinical, every time you do a case study or a simulation. Let me explain it to you first, and then we can move through how it might actually work in your day-to-day study. So thin thinking is composed of 4 different areas. T for top 3, H for help quick, I for identify greatest risk or safety need, and N for the nursing process. Now, what I recommend you do is get 4 Post-it notes, and those 4 Post-it notes are really important. You're going to want to keep them around. You're going to want to use them often. We're going to create 1 Post-it note for each of these 4 areas. Let me explain. If you need to grab your Post-it notes, go right ahead, pause the video, go grab them. But let me explain, and I'm going to show you 4 different colored Post-it notes. Anytime you can infuse color into your study time, you're going to save time studying because that color is going to help you make some associations. So let's look at the first one, top 3. On this Post-it note, I would literally like you to write these words, top 3 needs, concepts, questions. Write those words on that Post-it note, okay? Go ahead and pause the video if you need to. Top 3 needs, concepts, questions, okay? So that's your first Post-it note. When you walk into a patient's room, you want to make sure that you're asking yourself, what's a priority for this patient right now? What do they need right now? The next Post-it note, what I'd like you to write down is called help quick, okay? And on the words that I'd like you to write on this Post-it note are help quick, act now, what's best for the patient. Nursing is an action-based profession. We have to use our clinical judgment to make those to make things happen. National Council, the people that write NCLEX, the people that manage NCLEX, National Council, State Boards of Nursing, what they say is you take critical thinking and clinical decision-making, you put them together, and the action, the doing part of nursing is clinical judgment. Help quick, act now. When you walk into a patient's room, there's something you can do right now. When you're looking at a test item, ask yourself, what do they want the nurse to do? What should the nurse do right now? Help quick, act now, what's best for the patient. Now, the next one is identify greatest risk to safety, okay? And I'd like you to write those words on your Post-it note. Again, feel free to pause me at any time. You're lucky, you get to pause me. Feel free to pause at any time, but write down these words on this third Post-it note. Identify greatest risk to safety. You want to subconsciously train your brain when you walk into a patient's room, when you begin a simulation in the nursing lab, when you're looking at a test item, where is that safety component? Regardless of whether or not you're in fundamentals and you've only been in nursing school for a few weeks, or you're going to be taking NCLEX in a few weeks, you've got to create this subconscious just mindset of looking at a patient scenario through a safety lens and saying, where's the safety concern here? When I teach med-surg, a lot of times I'll teach GI or neuro or something like that. If you sat through one of my GI med-surg lectures and I lectured, I talked to you for 2 hours straight, oh, that would be awful. But if I did, you have to ask yourself, even if I did not say the word safety one time, you have to ask yourself, where are the safety concerns in this discussion? You've got to train your brain to just automatically be looking for it. This third Post-it note is designed, the I part of thin is designed to remind you of that. Now, our fourth Post-it note is the nursing process, but here's a trick question for you. What are the 2 most important parts of the nursing process? Think about it for a moment. What are the 2 most important parts of the nursing process? Now, you're thinking, oh my goodness, how can that be? They're all important. We need all 5 parts of the nursing process, and you are absolutely right. But what I've learned from the people at National Council that write the NCLEX, and because they do so much research on brand new nurses who've just passed the NCLEX, literally they research thousands of them every 3 years. They'll do this huge research study. Anyways, the two most important parts, according to National Council, are assess and implement. Okay, so on this Post-it note, this fourth Post-it note, what I'd like you to write is nursing process, assess, implement. Okay, so when you're taking care of a patient, do you have enough information to act? Because if you do, the correct answer on the exam usually has to do with action, that clinical judgment piece. Do something with what you know. An example, a perfect example, and I see this all the time in clinical with nursing students, with brand new nurses. They're like, oh my goodness, the blood pressure is really high. Okay, and they'll go to the EHR, the electronic health record, the electronic medical record, and they'll be like, okay, what was the blood pressure on nights? Oh, the previous shift on nights, it was really high. Okay, well, we'll continue to monitor. No, you don't do that. If you have data that indicates an action needs to be taken, that indicates something needs to change, you've got to do something. Okay, that's that assess, that implement. And the reason I think that National Council puts so much emphasis in these two parts of the nursing process, the reason is, I believe, is because what they're doing is they're attributing it to, that's what the nurse does subconsciously as he's walking down the hall, as the nurse is sipping his coffee or his Mountain Dew, whatever your drug of choice is. As he's walking down the hall, he's thinking, assess, implement, assess, implement. When you walk into a patient's room, you'll hear sometimes, they'll say, hey, students, is this test item an assessment test item or an implementation test item? Well, guess what? The nurse does both simultaneously. And so, especially on NCLEX, you're going to see questions that aren't going to be an assess question or an implement question. You're going to see where the nurse is doing things simultaneously. And you'll think, okay, they're asking for more data, but my assessment has indicated there's an opportunity for action here that needs to happen. You have these 4 Post-it notes. Here's what I want you to do. As you're caring for your patient, okay, as you're taking an exam or a test item, what I'd like you to do is have these 4 Post-it notes nearby. Have the Post-it notes nearby, and you're going to, maybe as you get report and you have your report sheet, maybe as you're getting information before a simulation, you're going to look at these 4 Post-it notes and you're going to say, okay, based on what I'm learning about this patient that I'm going to be caring for today, maybe it's a case study in class, I'm going to use top 3. I want to be thinking about what are the top 3 needs of this patient. Okay, or maybe it's a help quick. Maybe I've picked up something in the report that's going to be a help quick. The issue is and again, these Post-it notes are not meant to be stared at for hours and hours. It's meant to create a habit of you thinking this way. Okay, so as you engage a patient, you're actually looking at these Post-it notes, going, which one would help? Now, students, you've heard me say this many times. Daily, you need to give yourself a quiz all throughout nursing school until the day you take NCLEX. All right? You have to know what you don't know. Now, let me explain to you what I mean by take a quiz. And I usually recommend 20 items, sometimes 50 items, depending on the day. What I recommend is, get that freebie quiz that came with your NCLEX review book, that freebie quiz that came with your med surg book or your maternal child book. Or maybe you have adaptive quizzing at your school, that's fine too. But what you do with these 4 Post-it notes, you're taking your practice quiz. Now, don't do this if it's a proctored graded exam. You can't bring your Post-it notes, okay? But when you're practicing on your own time and you've got that computer out, you've got your phone out, you're doing those practice quizzing, look at your 4 Post-it notes. As you read the stem of the question, pause for a moment, refer back to your Post-it notes and grab one and put it in front of you. Okay. Oh, I think this question, I think top 3 is going to help me. I'm going to ask, what are the top 3 needs, concepts, questions, concerns for this patient? Grab that Post-it note, read the stem of the question again, pick your answer, take the answer back up to the stem of the question, and move on. Move to the next one. I recommend you take all 20 questions at one time, all 50 questions at one time. Then you hit submit. and you go back and only look at the questions you got wrong. If you got questions correct, don't worry about those. Even if you got them right by accident, you don't have time to worry about those. Worry about the ones you got wrong, and go take a look at that question again. Grab a Post-it note. Take a look at your 4 Post-it notes and go, okay, which one of these Post-it notes would have helped me? As I look at this question, I see that it's identify risk for safety, or I see that it's actually a help quick question. You pick up that Post-it note and you put it in front of you. Students, when you do this on every single practice quiz, you know what's going to happen? You're going to start thinking subconsciously. You're not going to even have to focus. Thin thinking is just going to automatically do what you're doing. It's automatically going to be a part of that. So I encourage you, students, I encourage you to take a look at thin thinking with every question, whether you're a brand new fundamentals student or whether you're actually moving towards the end of the program, getting ready for NCLEX, okay? Do let us know if you have any questions about thin thinking, and I appreciate your time and your focus on this today. Have a great day. Bye for now.